Are you a COVID long hauler, or do you know someone who is? Well, if you don't know what a COVID long hauler is, that's what we're talking about today because, guys, this is blowing my mind. Yahoo News recently did a story on COVID long haulers, and one of the patients they featured in this news story states that she was infected with COVID back in April after she got the condition from her husband. She said she's still now suffering what they call flare-ups. She gets severe bouts of diarrhea. When she's sleeping, sometimes her pulse drops so low she awakens, gasping for breath. She's undergoing a sleep study, I guess, to figure out what's going on, but her brain feels foggy. She started to stutter and she's fatigued. She gets debilitating headaches and dizzy spells along with muscle and joint pains. And sometimes she feels like her vision is blurred and her hearing is now slightly impaired. Now, let's go back to basics with COVID. We know that about 80% of patients will have mild to moderate symptoms, and we expect that they will mostly improve in roughly 2 weeks. Of course, there's give or take, and not everybody follows that model, but that's typically what we think. Now, we also know that about 20% may have more severe symptoms, and for those, it can take 3 to 6 weeks to improve in terms of symptoms. But yes, you're right. Some people can take longer, some people maybe a little less. Then we have COVID long haulers. They don't fit in either of those groups. Those are people that have had symptoms for weeks and weeks and weeks, sometimes even months. That's right. This is something that I want to say is a new phenomenon because, well, COVID is new and we are learning about all of this. In fact, COVID long haulers, that's the term given to these people who have symptoms that last for weeks and weeks. There's apparently a Facebook group for COVID long haulers because we're starting to hear more stories about this. COVID long haulers could have had mild disease when they had COVID or severe disease. They could be on the younger side or the older side. They may have severe symptoms remaining or not so severe. They still have lingering symptoms weeks and weeks and weeks later. Some of the symptoms people report are things like cough and shortness of breath, feeling a tightness in the chest, being severely fatigued, and having what we would call a decreased functional capacity. That is, these patients are not able to do what they normally are able to do, whether it's just normal housework around the house or exercising like they normally did. Even if they're young and healthy and fit and active, they can't play with their kids. They just don't have the energy. We are seeing more and more stories about COVID long haulers popping up in the news. And like I said, guys, I think this is not only important, this is something we need to watch closely and learn about. Now, guys, it seems that everyone who falls into this category of COVID long hauler has different symptoms. It seems like no two cases are the same. We don't exactly know why this happens to some, how long it will happen for, what exactly is causing it, and when the symptoms will improve. Again, COVID is a very new disease, but I can tell you one thing. When we said in the very beginning of COVID back in April, March, February, that this was an upper respiratory disease that just had fever, shortness of breath, cough, and sometimes pneumonia, we were wrong. Because we have learned, I've done segments with you guys on how many other symptoms COVID-19 can bring on to people. And now we're hearing potentially people have symptoms that last for weeks and weeks and weeks. We were wrong when we said it was just fevers, chills, shortness of breath, and maybe pneumonia. Clearly, it's more than that for some. Why? Well, is it the inflammatory response that the body has and what's going on in the body and the potential cytokine storm that we think may be happening and so many other things that's happening? Well, that's very possible, but the truth is we don't know. So we still have a lot more to learn. Guys, this is something I'm going to keep you updated on. We need to follow this closely. I want to hear from you. How many of you were infected with COVID-19 months ago, many weeks ago, and are still experiencing symptoms now? How many of you consider yourself a COVID long hauler, or you know someone who is or considers himself that? Tell me what your symptoms are. Tell me what you've done. Tell me what your doctor is saying and what you're going through. Guys, please also share this with others because I really want to understand what we're seeing. We are going to hear more and more about this. Please like and follow my page. I do daily health videos. And if you're interested in sending stars, I do answer your questions first. Guys, I'm Dr. Jen Caudle. I'll see you soon.